Hi everyone, and welcome back to my channel. My name is Sophie, and this channel is chronicling my journey of living my best life with multiple chronic health conditions. Today I will be going over the test results from Cleveland Clinic. I have all of them back, and I'll start with the normal one. So my lab work was normal. I got a CBC, or complete blood count, a CMP, a complete metabolic panel, and an NT-proBNP, which is looking at like heart function, sort of if you're in fluid overload and whatnot. So all of that was normal, which is good. Then I had a tilt table test, which is where you are lying on a table and then they tilt you upright and they see if your blood pressure or heart rate changes, and mine did not. Mine basically stayed the same, which does happen from time to time. The room was also really cold, so I'm not sure how much that played a role in it also, just because my heart rate when I was lying flat was so high for me. I just think the room was cold, so I was trying to stay warm, but tilt table tests are not perfect because you're not always symptomatic. Like, I haven't been symptomatic lately, so I'm not surprised that it was normal. But the other two tests were not normal, so that's what I want to spend the time talking about. So the other autonomic test I got done was a QSART, or a quantitative pseudomotor axon reflux test. So what they do is they put a device on your foot, your ankle area, and like further up on your calf, and one on your wrist, and they basically see how long it takes you to start sweating and how much you sweat. And to do that, they clean the area. They put a special little gel thing on your wrist, on the areas, and then they put electrodes on the areas, and then they stimulate the nerve that produces sweat, and they see how long it takes you to start sweating and how much you sweat. So my forearm and my upper leg were normal amount of time before I started sweating, normal amount of sweat. My lower leg had an increased time to start sweating. So normal is between 50 seconds to 2 minutes and 20 seconds, and it took me 3 minutes and 5 seconds to start sweating, but the amount I sweat was normal. Then my foot had increased time to start sweating, so increased latency and decreased sweat. So normal latency is 1 minute 20 seconds to 2 minutes 30 seconds. It took me 4 minutes 5 seconds. And then I was just below normal. Normal is greater than 0.07 milliliters per centimeter squared, and I was 0.06. The interpretation was non-specific for etiology, but suggests a mild distal postganglionic sympathetic pseudomotor abnormality that is seen in autonomic or small fiber neuropathy. I didn't hear from the neurologist. I doubt anything will be done. He didn't really seem interested in doing anything about my abnormal EMG or NCS either, if you watched that video last October. So like I said, I don't expect anything to be done with that. But I know it was abnormal. And that kind of makes sense because when I wear my compression stockings, there's a seam that will go like over your big toe. And most times seams just don't bother me, but sometimes my big toe will just burn really badly, and burning is obviously like a neuropathic issue. So I figured I had some small fiber neuropathy. I'm not surprised. And then I had an echo with agitated saline, so a normal echocardiogram, and then what they do is they put the saline in. So I had an IV, the saline in, because with bubbles, because they want to see if the bubbles go from the right side of the heart to the left side of the heart. to see if I basically have a hole in my heart. I do not. I was not expecting to, because I think I would be worse off than I am. But there were some abnormalities in the echo. Well, I guess first, let's start with the ejection fraction, so the percentage of blood the heart pumps out. My ejection fraction did increase. When I had the cardiac MRI in October, it was 54%, and it was 58% on the echo, but the actual amount of blood my heart is pumping out dropped significantly. It dropped from 70 milliliters to 47 milliliters. So yes, the ejection fraction technically improved, but because my other numbers have dropped, the amount of blood that's getting pumped out is actually less. So I guess just for comparison, the end diastolic volume, so the amount in the left ventricle before it pumps, was 128 milliliters in October, and now it is 82 milliliters, so that was a big drop. End systolic volume, so how much is left over after it pumps the blood out, was 58 milliliters, now is 34 milliliters. Yes, it's lower, but it started out significantly lower as well. And then, as I said, stroke volume, which is the amount of blood pumped out with each beat, was 70 and is now 47. So again, technically there was an increase in ejection fraction, but practically my heart's like I'm getting less blood flow. So I do see a cardiologist on Thursday, so I will be asking about that. And then just let me find it here. It says I have trabeculation in the apex of my left ventricle, and I can't find if some trabeculation is normal. So that's sort of where there's like outpouches of muscle, cardiac muscle in the ventricle. So instead of being nice and smooth, I guess I'll do it this way. Instead of being nice and smooth, there's like some outpouches. And that can cause issues with blood flow. I haven't seen that in any of my other tests. It's, from what I can gather, normally a genetic thing that you're sort of born with and it's there. But it hasn't been mentioned on any of my other tests. And again, I don't know if some degree of trabeculation is normal. Again, I will be asking the cardiologist about that. And then the other thing, well, there's some more things. Let me find the exact wording. Well, I'm looking, oh, there it is. So looking at the pulmonary venous blood flow, so the blood coming out of your pulmonary veins into your left atrium, it says the pattern shows a blunted systolic flow. So in systole, when you should have the most pulmonary venous blood return, I don't have the most. It's blunted, it's decreased during that time. And I could only find reasons of like severe mitral valve regurgitation or left atrial enlargement, and it didn't say I have any of those things. So again, I'll be asking the cardiologist. And then moving on to the valves, I do have trace regurgitation in my mitral and tricuspid valves. Those are between the left atrium and left ventricle and right atrium and right ventricle, but it's only trace. It's probably meaningless, basically. But I do have mild thickening on my mitral valve, my tricuspid valve, and my aortic valve. That is new. That's never been mentioned before. And I just had a cardiac MRI in October, so we're talking 6-7 months ago. So yeah, I don't consider that to be a good thing. So I'll definitely be talking to the cardiologist about all of this and just what it means, if I need to be on medication. And then of course I have the fibromuscular dysplasia specialist in June, and I know I'll be put on medication for that. So I'm looking at possibly being put on quite a few more medications, which I am not thrilled about. But what you're going to do, I will keep you guys updated. This will go up Saturday. I fly home on Saturday. Wednesday, I will update you guys on the genetic tests that I had done and what the results were there. And then next Saturday, I will probably update you guys on what the cardiologist has to say. So we will just continue on this medical updating journey we are currently on. Then thankfully I get a little bit of a break from doctors. I don't see my PCP until the middle of May. But hopefully by then I will have some of my GI test back from the functional nurse practitioner that she ordered. They have sent out the food sensitivity test and the small intestinal bacterial overgrowth test. And this coming week, I might get the NutriValve test done to see how my nutrient stores are, and I'll be getting her blood work done as well, looking at my hormone levels and some other tests. So lots of medical stuff going on at the moment. The joys of getting health insurance once again, I suppose. But this is long enough. I will talk to you guys next time. Bye, guys.